West Nile virus and yellow fever virus, which are single-stranded positive sense RNA viruses enveloped in a protein coat. Once inside the host body, the virus will attach itself to a cell surface through receptor-mediated endocytosis. This essentially means that the protein and DNA material of the virus are ingested into the host cell. The viral RNA material will undergo several changes and processes inside the host cell so that it can release more viral RNA that can be replicated and assembled to infect neighboring host cells. The data on transmissibility via insect vectors of hepatitis C virus also belonging to family Flaviviridae, as well as hepatitis B virus belonging to the family Hepatodonaviridae are inconclusive. WHO states that there is no insect vector or animal reservoir for HCV. While there are experimental data supporting at least the presence of PCR detected hepatitis C viral RNA in Culex mosquitoes for up to 13 days. Currently, there are no specific vaccine therapies for West Nile virus approved for humans. However, vaccines are available and show promise for animals as a means to intervene with the mechanism of spreading such pathogens. Diagnosis. Doctors can typically identify a mosquito bite by sight. A doctor will perform physical examination and ask about medical history as well as any travel history. Be ready to give details on any international trips, including the dates you are traveling, the countries you visited, and any contact you had with mosquitoes. Dengue fever. Diagnosing dengue fever can be difficult, as its symptoms often overlap with many other diseases such as malaria and typhoid fever. Laboratory tests can detect evidence of the dengue virus, however, the results often come back too late to assist in the directing treatment. If infected, a blood test may show a rising level of antibodies to the West Nile virus. A lumbar puncture is the most common way to diagnose meningitis by analyzing the cerebrospinal fluid surrounding your brain and spinal cord. The fluid sample may show an elevated white cell count and antibodies to the West Nile virus if you are exposed. In some cases, an electroencephalography or EEG or magnetic resonance imaging MRI scan can detect brain inflammation. The Zika virus. A Zika virus infection might be suspected if symptoms are presented and an individual has traveled to an area with known Zika virus transmission. Zika virus can only be confirmed by a laboratory test of body fluids such as urine or saliva or by a blood test. Chikungunya. Laboratory blood tests can identify evidence of chikungunya or other similar viruses such as dengue and Zika. Blood tests may confirm the presence of IgM or IgG anti-chikungunya antibodies. IgM antibodies are highest 3 to 4 weeks after the beginning of symptoms and will continue to present for about 2 months. That brings us to the end of this module. Thank you.